Well, let's now turn our attention to the Democratic Republic of Congo, where the Health Ministry has confirmed the usage of the experimental MAB-114 Ebola treatment on patients in the east of the country. The first time that it has been deployed against an active outbreak. The outbreak in eastern Congo's North Kivu province has now spread to neighboring Ituri province, where a person who was confirmed, a confirmed case died after returning home from the flare-ups. Epicenter in the North Kivu town of Mangina. Infection disease specialist Dr. Joseph Onigbinde joins us now in the studio to talk more about this. Thank you very much indeed for coming.
Thank you for having me.
All right. Well, studies show that at the moment, about 41 deaths recorded, then about 57 probable cases and all of that. It should worry us how Congo relapsed again. What do you think could have been responsible? A relaxation of the measures earlier taken?
Well, I won't say that it's because of relaxation. It could be also, but one thing we should know is that when it comes to Ebola, there is no way we can completely eradicate it. We know what causes Ebola. We know the fruit bats and all the common what they are normal hosts, but to completely eliminate these normal hosts is impracticable, you know, and our people keep touching and interacting with all these animals, fruit bats, chimpanzee, and so on. So, and they abound in the rainforest area of Congo and even West Africa. So it is practically impossible to eliminate them. The only thing we should do is to step up our surveillance system and to get, whenever they come, we react very, very swiftly, like we did in Nigeria a couple of years ago, so that they don't catch us napping. So it is impossible to completely eliminate Ebola. Ebola will still come, but we must get up and we shouldn't drop our gauntlets. We just face the challenges. And I think at this point, I want to say that what you used to see in those days when Ebola visited Nigeria in 2014, we have all these checks at the borders and both sea borders, all our ports, but we don't see them again. I think we don't have to relax. We have to keep checking people because our people are very mobile. They go to and fro.
All right, we understand, of course, it's agreeable that Ebola may not be completely eradicated, but the measures that were, you remember when it broke out on the continent of Africa, quite a number of countries suffered from it, but eventually they were able to contain it, but now it broke out again in Congo. We hear that some of the areas where it has broken out at the moment and still spreading have very difficult access routes. So how concerned should health officials be?
No, I think we've said it over and over that our structure, especially primary health care, is not good enough, and that's why we have problems. These epidemics most of the time start from the rural areas, and that's where our people live, and the public health system, the primary health care system is not the best, as it were. So I think, like, I want to agree with you that we should not just drop our surveillance system. We should make sure that these structures are working. Like you said, when it came to Nigeria, everybody was, hands was on deck, but barely 2 years after, everybody has gone to slumber again. This should not be, actually.
All right. What other measures do you think can be put in place at the moment to ensure that will help? Let's look at the experimental treatment vaccine at the moment, MAB-114. What's your take on that experimental vaccine?
Yes, the experimental vaccine is developed by Canada, but it's now being developed.
And this is the first time it has been deployed to tackle active outbreak.
Yes, it's still experimental, so it's not yet in a commercial quantity. So they still have to perfect a few things concerning it, but it is actually very effective. So I think efforts should now be geared towards getting it
to get more
yes,
of it,
and to commercial quantity. I understand in DRC, they said they are going to deploy about 7,000, whereas the government said they needed about 300,000. It's a far cry.
So there's a huge gap,
yes,
really.
Yes, yes.
And that's a challenge.
Yeah, it is, absolutely.
So what exactly should be done at the moment to help measures that they have on ground so that this thing is completely nipped in the bud? Because we hear that it is spreading very fast.
Well, we have to, like you just said, this experimental vaccine, we have to get it up and in large quantity, commercial quantity, and to, like I said, this Ebola may still come back, but we must be ready for it. So I think it is time we actually step up. Even Nigeria, all the other camps, we don't just wait on WHO alone. Try to develop, I mean, the vaccine has already been developed, so you help to produce it. So I think efforts should be to fund our healthcare system. Funding of our healthcare system in Africa is almost zero, and that is unfortunate.
Very unfortunate, and our leaders keep traveling overseas,
yes,
going on medical tours and all of that.
It is a shame, actually.
It is. Well, Dr. Joseph Onigbinde, infectious disease specialist, we thank you very much, as always, coming to share your thoughts with us.
Thank you very much.